So, Mr. Blake, I'd like to summarize everything that we've gone through today. Looks like we're dealing with some acute mid-back pain, kind of worse on the right side. You didn't really have any trauma or anything that started it, but you did notice it a few weeks ago whenever you were carrying your daughter's lacrosse gear. So it looks like it's dull and achy, but whenever you turn to your right side, it kind of has like its sharp episodes. And I know that you're an office manager at Ford, so you're sitting at your desk all day, and some of your exercising, such as weightlifting and jogging, have had to been decreased for this. So in terms of the pertinent exam findings that we went through, we did some orthopedic testing, and it showed the same thing that you've explained, where rotation of the right seems to aggravate it. But we also found some faulty shoulder movements, such as whenever we're doing the wall angel, that was difficult. Overhead squat was difficult, and external internal rotation of that same side shoulder showed to be difficult as well. So I wanted to get a look at you too as a patient, and looks like your largest concern and fear is that your company is facing layoffs, and it's kind of just adding increased anxiety to you already. And then as well as you're kind of nervous or leery to do this telehealth when you're convinced that massage and cupping can go all the way. And I'm not saying it can't, but what I am saying is that in a biopsychosocial kind of thing where we kind of focus on you as a person, we want to make sure we're doing everything in our capability to get you the right care you need. And I kind of wanted to focus on the stress aspect of that, which I know you're anxious about work, and I know you're kind of leery about even doing this telehealth, but stress has been shown to negatively affect pain thresholds, which is how you perceive pain, could be different than mine, and has negative effect on treatment recovery time. So we'd like to kind of decrease that. I think, how is it? Yeah, stress management at work. I know that you're an office manager. Maybe see what the cutbacks need to be done, and you won't have to worry about the layoff if so. Then I want to get to the other recommendations. So I want to I don't know if I told you already, but what we think we're dealing with right here is called segmental dysfunction, or some people call it subluxation. So you have joints in your mid-back, which is your thoracic spine and your ribs. Both ribs and thoracic spine, they all have articulations, and those articulations can become stuck in terms, and that inflammation and muscle spasms that accompany that can cause pain, and that might be what the pain is feeling from. So, and these joints require motion. That's whenever they're stuck, that's where the inflammation sets, and that's where a muscle spasm begins. So, let's take a look. Yeah, the exercises. I know you're leery to do the telehealth, and you've had mostly passive therapies, but active therapies are where the patient takes control of the motion or the movement or whatever is done, and that's what we're going to try to offer you today. We have 2 exercises we're going to be doing. The first one will be standing rows. We're going to be doing 3 sets of 12 reps 3 times a week. Now, I'm going to try to show this the best that I can. I don't have the best layout right here. But what you can do is, if you have a band, tie it to a doorknob. Man, I hope that'll do. Okay? Just like I've done mine. Yeah, that's not gonna work. You can see my body. Kind of try to find an even area. And like, I'm gonna get down on my knees. You don't have to get down on your knees. I'm just trying to do this for the video. You can do it standing. But you're gonna have your arms extended out. You're gonna be pulling back. You're gonna try, for external cueing, I'd like you to try to pinch your scapulas together. Pinch your shoulder blades together. Okay, and then extend back. Hold for 1 second. And then release. So those will be your standing rows. And then we have another exercise that I'd like to have. This will be quadruped thoracic rotation. So we're going to be doing this both sides. I know your pain is on the right, but we want to get the whole body in motion. We want to get all those joints in motion. Usually vertebral subluxations or segmental dysfunction is treated very well with adjustments, but through telehealth we can't do that. So we want to get some motion in different ways. Right here, an external cueing, hand on top of the head. We're going to sit back on our feet. That's going to lock out our low back so we're not using our sacrum and low back to turn. Right here, elbow down, external cueing. I want your elbow to be facing the ceiling. And you're going to come slow, methodical movements, breathe through everything. And I'd like that both sides. And external cueing, I want elbow to the ceiling, using your torso to rotate you. We're going to be doing the same prescribed sets and everything for that one. It's going to be 3 sets of 12 reps, 3 times a week. And I believe that should be it. Thank you, Mr. Blake.